Maybe Dr. Aysam, I will shift back to you. How can pharmacists maybe realize more of these symptoms that are related to environmental factors that are caused by climate change? How can they recognize these symptoms easily? Because I think they lack some skills and some tools to make them, I don't want to say diagnose, but maybe recommend the best
differentiate what's the disease, what's allergy, what's related to the climate.
Like, for example, dry cough, wet cough. Do they differentiate between that? Non-allergic, allergic. So what's your take on that?
Yeah, actually, first of all, we should take like a very clear history from the patient, what exactly he's feeling and the duration of that feeling. For example, patient visit the pharmacy before he visit for the doctor, asking about a medicine for nasal congestion. It's very important to know since when this nasal congestion. Is it fixed? Is it on and off? One side, two side, changing one nostril to another? All these important questions can give a hint for the pharmacist. Is it like structural or functional?
Okay.
So this is the first thing that he need to, because...
So when did it start?
Yeah.
Exactly. The timing.
For example, a patient who is suffering from a fixed nasal blockage right-sided since more than 2 years, you don't give any medication.
Yeah.
Go and visit your ENT doctor because maybe there's a structure issue.
Visit you, basically.
Maybe. And because we see a lot of patients started using this decongested, local decongested for long time. For a long time.
And we know the bad effect of
it's addictive.
Yep.
And even when I want to help this kind of patient, I cannot help him before he stops the medicine. Because this nasal decongested, all of us know that should be used not more than 5 to 7 days maximum.
Because of the rebound effect associated with
it. Because it's a change the nasal cavity to a functional organ only to like a corridor for air. That's it. The nose is not only a passage for air. No. If we need only a passage for air, we can use our mouth. The nose humidify and modify the temperature of the air going to the chest, filtering these small particles. So the nose give the air to the lungs in the standard limits. If we change the nose to only that a passage for airway with all the dust and the particles and the humidity, which is not good, and even the temperature, it means who will affect it? The throat and the chest. Throat, it means that long-term dry cough, because the throat is not created with a filter.
Okay.
So questions, planned questions, organized questions will give the pharmacy the hint when he will start and what he will give the patient. Another example, like a patient coming with this sneezing, runny nose, especially in the morning, on and off.
Seasonal, let's say, for example.
This one more thing, we will get back to this point, doctor. Seasonal now, the updated classification, no seasonal.
Okay.
Persistent or intermittent. Why? Because there is no seasons now. And this because of the climate change. There is no seasons. The patient who has allergy may have even that what we call that seasonal. Now it comes every 2 or 3 a month. We cannot consider it as seasonal.
Okay.
Because
so we
for
call
example,
it intermittent. Maybe.
Intermittent.
Yeah.
So the updated classification of ARIA for the allergic rhinitis and even asthma is persistent, intermittent, no seasonal and perennial. So when we ask this patient, we can find out that it's maybe allergy. We will start with a mild medication for him, but assure that no local decongested, of course, and give him the hint that if there is no response or something like a red flag symptoms happen to you, you should visit.
Such as, doctor, can you tell
like
the
a
pharmacist?
Fever, like a colored nasal secretion, like a facial pain, especially unilateral, like a periorbital pain, smell disorders. All these issues, you should visit the physician because we are not talking about a simple allergic rhinitis.
Okay.
Even if we are talking about a simple allergic rhinitis, the long-term treatment for allergic rhinitis is not only medication. Medication will help to relieve the symptoms, but now recently we have a lot of another levels of management for allergic rhinitis. We need to know what's the allergen. We need to know how to control it. And there is now the immunotherapy that we can offer for the patient, and even the biological therapy, which may be useful for such kind of patient. With the reminding that more than 20% of patient who has allergic rhinitis may have nasal polyposis, for example, and this cannot be treated only by medication. More than 40% of who has allergic rhinitis may have asthma. So the coughing thing that I'm coughing because I have allergic rhinitis, he has asthma, so he need to be treated by pulmonologist. So taking the good history and a planned, organized question will help the pharmacy to know what's happening in order not to put the patient in a risk factor that the pharmacy don't want.